Chapter 43: Anticoagulants, Antiplatelets, and Thrombolytics. Anticoagulants prevent the formation of clots that inhibit circulation. On the other hand, antiplatelets prevent platelet aggregation, prevent that clotting, while thrombolytics attack and actively dissolve clots. A thrombosis. This is a formation of a clot in an artery or a vein, and it's caused by that decreased circulation, platelet aggregation on the vessel wall, or blood coagulation. The arterial clot formation is, again, a platelet-initiated process where fibrin formation occurs and red blood cells are trapped within that fibrin mesh. In the case of venous clot formation, the platelet aggregation with fibrin, again, attaches to those red blood cells. Anticoagulants prevent new clot formation, used to prevent things like DVTs, PEs, MIs, artificial heart valves, and strokes. These do not dissolve clots that are already formed. Anticoagulants only prevent clot formation. Heparin. This is going to be a very common anticoagulant, and it's so common because it has such a rapid effectiveness. It's used to prevent thrombosis. It can be used both subcutaneously as well as intravenously. Heparin is monitored with the laboratory value PTT, and our therapeutic range is going to be 1.5 to 2 times the baseline. Obviously, it's going to have a side effects of bleeding and an antidote of protamine sulfate. Low molecular weight heparin. These are what we're using at the bedside to prevent DVTs after surgeries. They can also prevent things like acute PEs, though they have a lower bleeding risk. While the patient will not take aspirin concurrently with this, they also don't require frequent lab monitoring. Direct thrombin inhibitors. These directly inhibit thrombin from converting fibrinogen to fibrin and differ from heparin-like anticoagulants. Oral anticoagulants. Warfarin, Coumadin. This inhibits the hepatic synthesis of vitamin K, thus affecting the clotting factors. It's used to prevent thromboembolic conditions, though again, we want to monitor that PTINR. Bleeding is going to be a major adverse effect of warfarin. Fun fact, a lot of the delayed rat poisons and mouse poisons on the market are actually Coumadin, and that the mouse or rat will eat the Coumadin, send its PTINR through the roof, and actually bleed out internally and die. That's where it gets that delayed release from. The antidote for warfarin is going to be vitamin K, though keep in mind this takes 24 to 48 hours to be effective. In the case of acute bleeding, we're going to use fresh frozen plasma to have a much more rapid onset. Anytime we're giving any anticoagulant, we want a thorough history of their clotting problems. We want to hear what issues they have. Are they at risk of DVT, PEs? We want a thorough assessment. We also want to thoroughly assess the other side. Look for any issues with bleeding, any bruising, purpura, petechiae. We're going to monitor the proper lab very closely. For warfarin, we're going to be looking at that PT, the PTINR, and for heparin, we're going to be closely monitoring that PTT level. We also want to examine the patient's nose, mouth, skin, urine for any indications of bleeding, and teach the patient to inform the dentist when taking an anticoagulant before they go in, so that the dentist knows about their clotting risks. Antiplatelets. These work to suppress platelet aggregation. They also work to prevent thrombosis in the arteries, as well as the prevention of MI or strokes for patients with a family history. Aspirin. This is a drug that's been around for a long, long time, and it's a very effective and inexpensive treatment for suppressing platelet aggregation. It's a low-dose therapy that works to inhibit cyclooxygenase, an enzyme needed by platelets to synthesize thromboxane. Thrombolytics. These bind to the fibrin, promoting conversion of plasminogen to plasmin. They also work to degrade fibrinogen, fibrin, and other clotting factors to disintegrate that clot. Used to treat PEs, DVTs, thromboembolisms. These are the drugs that actually dissolve the clot, while antiplatelets and anticoagulants just prevent clot formation. We want to assess the baseline vital signs for any future comparisons, obtain a medical and drug history, looking for any indications of bleeding, dehydration, or tissue injuries. When giving thrombolytics, we want to monitor vital signs, observe for signs and symptoms of active bleeding, observe for signs of allergic reaction to thrombolytics, and also avoid administering aspirin or NSAIDs for pain or discomfort when receiving a thrombolytic. For our first practice question, a patient is prescribed aspirin 81 milligrams and clopidogrel. Which of the following drug classifications does the nurse identify for clopidogrel? Would that be an A, an anticoagulant, B, a thrombotic inhibitor, C, an antiplatelet, or D, a thrombolytic? And that answer is C, an antiplatelet. Practice question 2. A patient arrived in the emergency department 2 hours after an acute ischemic stroke. The patient is given an intravenous injection of alteplase, TPA. What is the most important for the nurse to monitor? Select all that apply. That be A, bleeding, B, vital signs, C, PT levels, D, allergic reactions, or E, electrocardiogram. And those answers are going to be A, B, D, and E. Bleeding, vital signs, allergic reactions, and ECGs. Question 3. Which information will the nurse include when teaching a patient about warfarin therapy? That be A, increase the amount of green leafy vegetables in your diet. B, rinse your mouth instead of brushing your teeth. C, follow up with laboratory tests such as PT or INR to regulate the warfarin dose. Or D, use a new razor blade each time you shave. That answer is going to be C, follow up with laboratory tests such as PT or an INR to regulate the warfarin dose. Question 4. A patient is on heparin therapy secondary to deep vein thromboses. The nurse has which medication on hand as an antidote in case it is needed? That be A, vitamin K, B, protamine sulfate, C, warfarin, D, aminocaproic acid. And that answer is B, protamine sulfate. The nurse is caring for a patient who received alteplase TPA for treatment of acute coronary syndrome. The patient starts to bleed. The nurse anticipates administration of which medication? That be A, protamine sulfate, B, vitamin K, C, warfarin, or D, aminocaproic acid. And that answer is going to be D, aminocaproic acid. Question 6. The patient develops a deep vein thrombosis. The nurse anticipates administration of which medication? That be A, intravenous heparin, B, clopidogrel, C, vitamin K, or D, protamine sulfate. And that answer is going to be A, intravenous heparin to prevent further clot growth. And for our final question, a patient is being discharged home on warfarin therapy. Which information will the nurse include when teaching the patient? That be A, results of activated partial thromboplastin time, a PTT, will determine if the medication is effective. B, international normalized ratio, INR results should be between 2 and 3. C, a normal response to warfarin is for your stools to look tarry. Or D, increase the amount of green leafy vegetables in your diet. And that answer is going to be B. The INR results should be between 2 and 3. For answer D, green leafy vegetables are chock full of vitamin K. And that's going to be something you see come up a lot in ATI and NCLEX. And that patients taking warfarin should avoid eating large amounts of vitamin K because that is the antidote. But anyway, that's all we got for this chapter. I'll see you in the next slides.